specifically working on what we have called infodemic, so how to tackle misinformation and how to provide accurate information to all of our audiences, including governments, including stakeholders, including population. So this is what Dr. Briand will focus her presentation on, and we will then take few questions. I know that many here in a room wanted to have a one-on-one with Dr. Briand after the briefing. Unfortunately, we will not have much time, so Dr. Briand will stay for 5-10 minutes just outside the press room. So those who want to have like a close-up camera and have one quick question can scrum around. So with that, I'll give a floor to Dr. Briand to briefly present the area of her work and where we are right now when it comes to this novel coronavirus, and then we will take questions. Dr. Briand.
Okay, thank you very much. Good morning, everyone. So indeed, when you deal with epidemic, you rapidly see that in addition to the epidemic of diseases, we often have an epidemic of information. And this is what we call infodemic. And it's really an epidemic of rumors, of false information that is circulating at the same time. And every outbreak has its infodemic. And so we have realized over time that this infodemic could be really an obstacle for a good response and hamper effective implementation of countermeasures. To give you an example, for instance, when we were dealing with the yellow fever outbreak a few years ago in Angola, there was a rumor that yellow fever vaccine, when you take it, when you are vaccinated, then you cannot drink beer for 1 week. And so we have seen immediately after that a drop in vaccine uptake because people were afraid that not being able to have their beer after that. So, but we have seen other examples, for example, during Ebola outbreaks where people, there were rumors that Ebola doesn't exist. And so this also hampers the implementation of good treatment of patients, etc. So infodemic for us is a real phenomenon, and it's very important to tackle it promptly, especially at the start of an outbreak when there is a lot of unknowns, because nature hates vacuum, and so if there is a known, people try to fill the unknowns with different kinds of information. And so for us, it's a real challenge. Another challenge is that before, I would say a few centuries ago, this phenomenon existed as well, but at that time there was no social media, and so the information was spreading as well, but much lower than now. Now the information is spreading very fast and is amplified immediately in every corner of the world, basically. And so for us also, this speed is very difficult to address in a timely manner. So what are we doing currently? And when I say we, it's not only WHO, it's WHO and many partners, because you will see that we try to have on this a global collaboration. We are trying first to give messages to different audiences and target the audience, but also tailor the messages to what are their main concerns. And this platform is called EpiWin, and have brought some one-pagers on that. And so EpiWin for WHO Information Network for Epidemics really tries to establish privileged links with certain audience so that we can understand what are their concerns and reply to their concern with appropriate answer. So for instance, yesterday we had a call with the business sectors, and Elderman was organizing this call with a number, there was more than 50 attendees from different companies, large companies in the world, and we discussed in particular what should those companies do for their employees? And most of those companies have employees around the world in different countries, and so they are concerned about this outbreak, not only because of what is happening in China, but also what is happening in other countries in the world, and what kind of messages they can give to their employee, nuanced messages, but useful messages as well that can help people to protect their health. We have also targeted different audiences, for instance, the travel and tourism sector, food and agriculture sector, also communities of healthcare workers through international association for nursing or medical international association and so on. So those different audiences have, of course, a different concern. I mean, and so we try to distill the technical information we have into messages that can be useful for them to amplify those messages within their own networks. Because another point that is very important is that we are using amplifiers, so people who can relay those messages to reach out more people. People are really looking for trusted source of information, and we very much would like to play this role and be at the forefront so to help and safeguard global health. The other activities we are doing is also trying to reach out to more people. Of course, there is a WHO website where people can access quite easily now because the novel coronavirus is on the front page. But what we have noticed in previous outbreak is that usually people have too much information. And so now we are partnering with other groups such as Google, and they have launched a new project called SOS Alert. And this will help people to have in one place all the information they can have they can find on coronavirus. And so this will be triaging as well, so that people have an easier access to key information. So in a nutshell, this is what we try to do. And of course, our communication people are dealing very much with media, because media and journalists are really one of our key audience group, and are also extremely important amplifiers. Only today I heard that there was more than 40,000 publication on novel coronavirus. So I think the amount of information is impressive. And this is why I think it's so important that we collaborate to make sure that the right information goes to the right place and to the right people at the right time. Thank you very much.
Thank you very much. So we will start with questions. Well, let's start with Catherine, and then Gunilla, then Lisa, then we go back here.
Bonjour docteur, je profite que vous parliez français pour vous poser une question en français. Est-ce que vous pourriez nous donner justement des précisions quant à la manière dont le virus se transmet, sa durée de vie sur des surfaces sèches, plates, et sur des surfaces humides? Nous donner quelques précisions techniques, parce que comme vous le dites, effectivement, on a toutes sortes d'informations qui circulent sur le net, et également l'utilité du masque quand on est infecté, ou quand on ne l'est pas, est-ce qu'un masque est utile? Et puis si vous pouvez également donner des précisions quant aux tests. Les tests sont fabriqués par qui? Quelle marque? Est-ce que c'est en France, en Chine, à l'étranger, en Suisse? Combien de temps faut-il un test? Comment ça se déroule, les prélèvements? Merci.
Voilà, ça fait beaucoup de questions. En français.
Bien, je vais répondre en français alors. Donc, pour ce qui est de la transmissibilité du virus, en fait, comme je l'ai dit, quand on commence une épidémie, le problème c'est qu'il y a beaucoup de choses qu'on ne sait pas. Et donc, au fur et à mesure que l'épidémie évolue, on arrive en fait à trouver des réponses à certaines questions. les réponses ne sont pas toujours complètes dès le début. Donc c'est au fur et à mesure qu'on arrive à compléter les réponses. Donc en termes de transmissibilité, vraiment pour l'instant on s'est focalisé surtout sur est-ce que le virus est transmissible de personne à personne. Et maintenant, on a des évidences scientifiques qui montrent que, effectivement, le virus se transmet de personne à personne. Et on est en train de voir, d'essayer de mieux comprendre est-ce que c'est facile, est-ce que cette transmission est facile. Et donc, pour l'instant, ce qu'on sait, c'est que c'est une transmission par gouttelette, ou droplet en anglais, et donc c'est la même transmission que d'autres virus, donc ça veut dire qu'effectivement il y a une possibilité aussi que le virus reste pendant un certain temps sur des surfaces et puisse, si les gens touchent ces surfaces immédiatement après, puissent se contaminer à travers ce contact. Mais ce que l'on ne sait pas encore, c'est combien de temps. Ça, on ne sait pas encore. Et c'est pour ça que, du coup, on préconise un lavage fréquent des mains. Parce que comme ça, si les gens se lavent les mains, même s'ils ont touché des surfaces contaminées, en se lavant les mains juste après ce contact, ils se protègent contre l'infection. Donc j'espère qu'au cours des semaines à venir, on aura plus d'informations là-dessus, mais la recherche, même si elle est extrêmement active actuellement, ça prend quand même un certain temps et on a un peu du mal. Il faut aussi un certain nombre d'observations pour pouvoir conclure formellement. Donc pour l'instant, on a des informations, mais elles restent quand même assez fragmentées et on n'arrive pas encore à avoir une vue complètement exhaustive de la question. Mais en tout cas, ça ne change rien à nos recommandations pour se protéger. En ce qui concerne le masque, donc, nous recommandons l'utilisation des masques pour les gens qui ont des symptômes. Pourquoi ? Parce que le virus se transmet à travers des gouttelettes, comme je l'ai dit, et donc les gens qui toussent ou qui crachent vont expectorer toutes ces gouttelettes dans l'environnement. Et les gens qui sont proches, des gens qui toussent ou qui se mouchent, ont beaucoup plus de chances d'être infectés. Donc, si les gens qui sont malades mettent un masque, en fait, ça va bloquer cette transmission et ça protège les autres. Donc, le masque est utile pour protéger les autres de l'infection. Pour les gens qui n'ont pas de symptômes, le masque, en fait, n'est pas utile, mais je comprends très bien que les gens soient très anxieux d'être infectés et qu'il y ait beaucoup d'endroits où les gens préfèrent porter un masque parce que ça les rassure. Cependant, il faut faire très attention, le masque en lui-même ne suffit pas à protéger complètement. Et donc c'est pour ça qu'il faut toujours continuer à se laver les mains régulièrement. Parce que le risque, en fait, c'est que les gens, sans se rendre compte, touchent des surfaces infectées et puis après touchent leurs yeux ou touchent le masque. Et là, en fait, le masque représente une fausse sécurité. Et les tests. Donc pour les tests, en fait, comme c'est un nouveau virus, en fait, les tests, pour l'instant, on utilise ce qu'on appelle la PCR, qui sont des tests qui demandent deux types de choses, des réactifs et puis ce qu'on appelle des primers. Et donc, pour l'instant, ces deux choses, ces deux composants sont produits pour la plupart par des laboratoires avec qui nous sommes en contact, surtout pour les primers. Et ce qu'on est en train d'essayer de faire, c'est de faire en sorte qu'il y ait une commercialisation de ces tests. Cependant, on a encore de tester, de voir la qualité des tests, parce qu'il faut que les tests puissent vraiment apporter une fiabilité dans le diagnostic. Donc, on a une équipe qui travaille là-dessus, avec des contacts dans plusieurs pays, pour essayer non seulement d'avoir des tests de qualité, mais aussi d'assurer que ces tests la qualité a bien été certifiée, et ensuite qu'il y ait suffisamment de tests pour tous les gens qui auraient besoin d'avoir un diagnostic. Pour l'instant, ce qu'on sait des autorités chinoises, c'est qu'ils ont assez de production pour faire les tests actuellement. Et actuellement, comme vous le savez, 99% des cas sont en Chine. Donc pour l'instant, de ce côté-là, on est bien. Évidemment, c'est une situation qui évolue rapidement, donc on essaye aussi d'être prêt pour si jamais il y avait besoin de plus de tests.
Merci beaucoup, Catherine. Merci beaucoup, Dr. Briand. Just maybe to say to our viewers that we are at the UN headquarters for Europe here in Geneva, and officially both French and English are used, so I hope this will not pose any problem to anyone. Gunilla, then Lisa, and then I have another round of questions. Gunilla, please.
Yes, hello, hi. My name is Gunilla von Hall. I'm a Swedish journalist, Svenska Dagbladet. 2 questions. When do you expect, Swedish journalist. When do you expect the epidemic to be declared a pandemic, and what will that mean for transmission and response? And my second question is, when countries now evacuate, it seems that they're dealing differently with people that come back. In France, for example, they are in a military base. People that came back to Sweden, they can basically move around as they wish, and it seems that there is a need for a better advice. Thank you.
So thanks for your question. So currently what we see is that, and especially in China, that 78% of the cases are coming from Hubei province. So Hubei province is the epicenter of this outbreak. And this is a place where we see intense human-to-human transmission, and where the Chinese authorities have also put in place what we call mitigation measures. So they have circumscribed this place. They try to avoid movement outside this place so that they can really reduce the transmission. And at the same time, as you have seen, they are building hospitals to make sure that they can treat very rapidly the people who are infected so that they can reduce mortality. Outside Hubei, we see spillover cases, I would say. People who were mostly infected in Hubei before there was a lockdown, and moving to other places with the disease. In these other places, then we have cluster of cases and cluster of transmission. But in these other places in China, the strategy currently is to stop transmission. We would like to make sure that we don't have a second Hubei type of scenario. And so we are still in this strategy to stop transmission in those places. Similarly, outside China, now we have 23 countries reporting sporadic cases. The aim is to stop transmission. And that's why countries are implementing early case detection, early isolation and treatment of patients, contact tracing to make sure that they identify very early contacts that become symptomatic, and social distancing measure in the places where there is a risk of transmission. And we hope that based on those measures, in Hubei, but also in other places where we have had spillover, we can stop transmission and get rid of this virus. Of course, it's challenging, as you have seen. Why? Because there is a lot of people's movement, and so, of course, and the virus is easily spreading, and so I'm not saying it's easy, but this is really the attempt, and we believe that it can be done. So that's why currently we are not in a pandemic. We are at the phase where it's an epidemic with multiple foci, and we will try to extinguish the transmission in each of these foci. So, yeah, okay, so indeed, so each country with imported cases is putting in place a measure they need to put in place to stop transmission. And depending on the type of public health system they have or health system they have, they will implement the measures with their own capacities and the way they are used to do it. So we agree on the risk assessment, but then we rely on countries to put in place the measures that are needed to stop this transmission. Of course, we will make sure that it's really that the measures are commensurate to the public health risk, and that the objective can be achieved with a minimum impact on other sectors. And regarding the repatriation, we are working with countries now. As you know, we have the executive board, so we have intense discussion with our member states to see how we can harmonize the practices and making sure that everybody share experience, what works best, and then so that other countries can implement what works best from their opinion. But as I said already, we are very early in this outbreak, and so people try their best to, and very fast implementation of things, and so depending on the country's experience and or previous experience in this kind of transmission, they try to put in place what they have ready, and so I hope that in the coming days we will be able to have an alignment and really learn quickly what works best so that we can implement best practices everywhere.
Thank you very much. So Lisa, and then we will go to a couple of other people who have asked for questions. Lisa, please.
Thank you. Good morning. Lisa Schlein, Voice of America. I'd like to go back to the rumor mill, please, and ask you to give us some prime examples of the kinds of rumors and cases of misinformation that is circulating right now, so you understand what is happening. And do you have any instances where some of this misinformation has really caused harm, and how do you combat this?
Okay, so for instance, I would not say rumors, because sometimes rumors has a negative connotation, but it's more what are the people concerned. So for instance, when we had this publication that there was a transmission from asymptomatic cases, people had suddenly the impression that the virus was in the air, and everybody who go under this cloud of virus will be infected. So this is not the situation. Currently, the virus is transmitted through droplets, and you need a close contact to be infected. And it happens also that people who were called asymptomatic in reality were at the very beginning phase of their disease, and so they had minor symptoms that maybe they have not interpreted this as a start of the disease, but they were not feeling really well, and so it was really the prodrome of the disease, but it was not understood like that by the patients themselves, but they were not really asymptomatic. So all these things we need to clarify for people, because otherwise people start to be extremely worried. They feel that maybe their neighbor can contaminate them, and so there is a kind of sense of panic. So we try to clarify what we know about the science, what is still unknown, and to provide a recommendation that can really help people to protect themselves and protect their families. The other rumors or concerns we have seen also is the fact that now we are trying to use some medicines and to find remedies for this coronavirus infection. And in particular, we are trying some antivirals that are already existing in the market and are already in use, whether it's for HIV people or for the drugs that we have used for Ebola, for instance. Because in vitro test shows that those drugs may have some effectiveness or efficacy on the virus. But we don't have currently information on how does it work in real patients. And so we are conducting those clinical trials. But so far, we have no evidence that those drugs are really useful for this novel coronavirus. But we have seen in social media that antiretrovirals could be useful for novel coronavirus, and then everybody will buy them, and then there will not be enough for HIV people, etc., etc. So a lot of concern about availability of drugs. So we are trying to address those concerns and clarifying to people that we are just at the phase of clinical trials, and when we have more evidence, then we will issue recommendation on treatments. So when we had experience of harm of those rumors, for instance, I remember during some Ebola outbreaks, there was rumors that first Ebola doesn't exist, and so and that this disease was invented by certain people to for political reason or to do aggressive contact tracing in communities, etc. So I think these rumors are harmful because then people, when they start showing symptoms of Ebola, instead of going and to the healthcare facilities and get help, they stay at home, they contaminate their family, and sometimes they die, and then they contaminate even more people during their funerals. And then instead of having a decrease in the number of cases, we have a super spreading event in a given community. So this is really harmful. Another type of very harmful rumors is that I remember some people were saying that, oh, don't go to the Ebola treatment center because then you go to this treatment center and people kill you and they take your organs to send them abroad. So this is also very damaging because actually we have made a lot of progress in treating Ebola, and even if we, even before we had some specific treatment, even with only supportive care, we could really reduce mortality. And we have showed this example in West Africa, that we went from 75% case fatality ratio to 33% just with supportive care. So good care helps to reduce mortality. And it's a pity that some people were not able to access those care just because they thought that people will kill them if they go to the Ebola treatment center.
So just very quickly, do you think that the measures that you're taking right now to combat these rumors and so forth will stop these kinds of very harmful rumors that have occurred, situations that occurred in Ebola and so forth? Or are you fearful that this could escalate and turn the coronavirus into a truly horrible situation?
So what we do is really first acknowledge that this infodemic exists and needs a specific treatment. And this treatment is not easy because it requires a lot of global collaboration. And it requires also using at their best the existing channel of communication like social media, your newspapers, etc. So, but I think it's a challenge of the 21st centuries. Because we are all beneficiaries of those extremely intense and fast communication, but also we could be the victims of it. So I think this is why it's very important to characterize the phenomenon and to develop methods to tackle it appropriately. So the thing is not censorship. It's really just trying to understand what are people concerned and trying to understand and respond to them the best way we can with the evidence we have at the moment. And this evidence will grow, hopefully, and we will be even better to tackle it maybe in a few days, but we will not start to have the entire evidence to start combating infodemic.
Thank you very much. So we go for the second round here. Then you have John, Jamie, and Gabriella. Please.
Hi, thank you. Liu from China's Xinhua News Agency. Two questions. First, from the daily situation report from WHO, the report mentions something about the supply chain or logistics systems to facilitate the delivering of personal protective equipment from suppliers to responders. And we have known that China was, and I think still has been, suffering from a shortage of medical equipment, especially those in Hubei province. Could you share some more concrete facts about what WHO has been doing to ease the situation of equipment shortage in China? And the second question is about the still unknowns. The unknowns about the virus remains unknown. Could that be understood as the fact that the sample data collected from China are not sufficient enough to draw any conclusions so far, or the samples, the data space is not large enough to draw such conclusions, and how that's going to affect the ongoing effort to fight the virus? Thank you.
So in terms of what WHO does in terms of global supply chain, the first thing we do is first we have identified in our commodity package what are the equipment that would be needed and the specifications. Because as you know, there are plenty of different type of masks, of other items, and so we have done this previous to this outbreak, but really an assessment of what are the best equipment to reduce transmission of this virus, and this is what is also on our website and the commodity package. The second thing we do is we help government to identify what would be the necessary amount of those equipment. And so there is a tool to calculate, based on the number of cases and the transmissibility, how many of each item you would need, so that government can plan and do advanced procurement. What we do as well is we try also to have an overview of what is the current global production capacity, so that we ensure that we can scale up the production if there is a need. We don't want to produce too many masks if at the end, maybe when summer comes, this virus transmission goes down, and then the outbreak fades away on itself, so on its own. So we need also to have some kind of planning of future needs, and all of this requires a lot of coordination at global level. And then finally, we also try to provide guidance to our member states on the quality of equipment, because as you know, there is always a lot of productions coming from new manufacturers in emergency, which is sometimes very appreciated, because it's needed to have more production, but sometimes we cannot verify the quality of those equipment. So also we try to make sure that what is produced is of high quality. So regarding what is happening in China, we have the discussion with the Chinese government, and so far they have not requested help on this issue, and they are trying to mobilize equipment and resources internally in China to the affected province, and they have mobilized, I think, already human resources and equipment to make sure that Hubei province can have access to the best level of care as possible.
And there was a question on unknown.
So on the unknowns, I think many research groups are currently working. So indeed, a lot of sample has been taken in China, and people are really busy. So the issue is not really that we don't have enough samples or we don't have enough data. It's more that whatever number of sample of data you have, it takes time to come up to a strong conclusion. You cannot base your final recommendation on just a small number of observations. So there is a need to have a standardized protocol for those observations, and then compile all those results and to make sure that we have the best evidence as possible. So that's why our guidance, but we are not waiting for all this evidence to provide guidance, but we are cautious in being definitive in our advice, because we are really waiting to make sure that the evidence is as strong as possible.
Thank you very much, Jamie, then John, then Gabriela. Jamie, please.
Back here, sorry. Hi, I'm Jamie from Associated Press. Thank you very much. I have a couple of quick questions. The first is, if you could, two quick questions and two clarifications. The first question is, last week, Dr. Tedros went to Beijing and met with Xi Jinping, specifically to ask for authorization to contribute to the effort in Wuhan. How unusual is that for you? Have you ever heard of something like that? The second question has to do with something that Maria, hold on one second, she said on internet, basically, she was talking about the name of this virus because some people are calling it Wuhan coronavirus and others, and the current name is NCOV, blah, 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 whatever. And a lot of people are just wondering maybe, how close are you to getting to a new name for this virus, and what might it be? So that, and then quick clarification. You mentioned earlier in French, I think, you said that the masks, or you said, well, you said in English, the masks, you don't want to overproduce masks, is what you said. You don't want to have a glut. Why is that a problem? Like, why would that be a problem to have too many masks? How can you overproduce masks in this case? And then you also mentioned that people who wear masks, the people who benefit from, or the real reason to wear masks is because it's for the people who are sick, that rather than for the people who are not. And I just want to make sure that the message that you're sending to people is, because there are a lot of people wearing masks right now, and it could give the impression that people who are wearing masks may be seen as people who are carrying the virus. So do you want to be clear about that, about what you're saying? Thank you.
Thank you, Jimmy. Yeah, maybe the thing on the mask we can repeat in English.
Yeah, okay. So on the visit of Dr. Tedros to China, the aim was really to discuss with Chinese authorities on what is their perception of the outbreak, and really understand from their perspective if they think they can stop the transmission. And so Xi Jinping was very clear that in this battle they really think that they can stop it. So, and this was really reassuring to understand that they have put in place very strong measures, and that they really hope that this will work. And so we need now to make sure that those measures really yield the results that are expected. So, is it unusual? I think Dr. Tedros has already been many times to DRC, for instance, for the Ebola outbreak, and has also discussed with the president of this country. So it's not unusual, and I think it's part of, it's always better to have face-to-face communication rather than maybe having very official communication, or both are really useful, but in this case, because of the urgency, it was very important to have face-to-face communication. On the name of the virus, I think it's a very important question because, you know, normally, I mean, or at least traditionally, naming of viruses were based on the place where they were discovered. And we had a very bad experience in the past with this habit. Because then the place where the virus was discovered was somehow stigmatized, and it has, in addition of being affected by a deadly disease, this place, in addition, was suffering from stigma from other countries, and so it was an unnecessary burden linked to a scientific tradition. And so that's why after the pandemic H1N1, where people called it swine flu, and then it affected the swine production sector, or some people said it's a Mexican flu, which is not very nice for Mexican people either. So we had a global discussion with our partner agencies, FAO and OIE, and also tourism and other sectors, to discuss, okay, from now on, when we have an emergency, how are we going to deal with this issue? And that's why we have issued a guidance for that, and we have a process. And so we have followed up the process. So, and I used already this comparison. It's like hurricanes, you know, they gave them names of people for hurricanes. So, so we don't want to go this road for viruses. So we try to have still names for viruses, but names that are not affecting either a country, a place, a given community, or people wearing a certain name. So we are really trying to be as neutral as possible, but as helpful as possible as well, because we need also to name things with the same name everywhere in the world if we want to tackle the enemy the same way. So I'm sorry for the mask if I have not been clear, and maybe it's because of a translation issue, but for me, I was more thinking of the procurement of masks. Indeed, we don't know where this virus will go next. What we know is it may go to developing countries. And developing countries will be probably very keen, as everybody, to protect their own population. We want them, of course, to procure masks, but we don't want them to spend their entire budget for health for procuring masks, because we know that they have other health issues like malaria, HIV, TB, and many other health problems, and they need also to dedicate funds for those problems. So we don't want them to just shift completely their expenses, health expenses, toward buying masks. And that's why the production is fine, but then the procurement and the advice we can give to countries, it's a different aspect. So I'm sorry if I have not been clear. And regarding how to use masks, again, maybe I can clarify on this. I think to stop transmission of this virus, it's very important that sick people wear masks. That's for clear. Then, in terms of risk, again, I've said that for people who have no symptoms, the mask will not necessarily protect them 100%, because if they don't apply other measures, it's not sufficient. So my message is more that mask alone is not enough. It's a package of measures that you have to put in place. And if people use the entire package, it's fine. If they just use mask, I think it's not enough. And this was what I wanted to convey as a message. So I hope it's clearer. Thank you.
Thank you very much, Gabriela. And then, sorry, John. John, then Gabriela, and then we'll have a few more, so we'll try to finish at time. John, please.
Good morning, Sophie. Firstly, can you elaborate a little bit, what are the levels of preparedness for the weaker countries with poor health systems that Dr. Tedros said was a priority, and specifically Sub-Saharan Africa? What is happening on that front? Where are you 5 days into this emergency? You have all the leaders of African countries in Geneva and the regional director of WHO for Afro. So if you could elaborate a little bit on that. And my second question is with reference to public information and awareness and not to have misinformation. Can you elaborate why the WHO will not release the notifications provided to WHO by member countries that are taking additional measures, health measures, that could impact on travel and trade? Why is it behind a firewall? Isn't that of public interest?
Okay, so on preparedness, as you may know, in 2005, member states adopted the revised IHR. And within this document, there was really a list of core capacities that countries should have. And so since then, we have been working with all those countries to make sure that they can strengthen their own capacities. We have seen major progress in certain countries, not so much progress in other countries. So now we we are reviewing those indicators and trying to focus on what are the key capacities that those weak countries need to have very quickly in place, and we are supporting them to make sure they can have it. So it means, for instance, for laboratory, we will supply reagents, also trainings, etc. So it's a huge machinery that we are putting in place. So many things are already happening because it was part of a more long-term preparedness effort, so we are just scaling it up. Other things are more targeting these specific preparedness, because this virus is a bit special, and so we are working with countries on that. Many countries have had outbreaks in the recent past, whether it's outbreak of yellow fever or meningitis or cholera. So certain capacities can be reused, I would say, and for this particular outbreak. Other capacities, we need to adapt them, and this is what we are currently doing. And so the executive board is also a very good occasion to discuss with member states and see how we can streamline support from other country to African country, and also Dr. Tedros, when we were in China, asked Xi Jinping if China would be ready also to help other countries, and it was, and they said yes, we will see if we can help. So what we hope is really that there will be a global solidarity, and that because we are all on the same boat, that there will be a possibility for those countries with weak capacity to rapidly strengthen their level of preparedness. On the notification, we have received a notification from 19 countries on the measures they are implementing and justification. And so we are currently in discussion with those countries to clarify what do they mean, etc., understand whether. And I suppose that after that there will be, when it's much clearer and that it can be shared, we will certainly put it on the website, provided countries are happy with the summary we have made of their rationale and justification.
Thank you very much. Gabriela, please. Then we will take two more, and we will really have to wrap up. We will be
Thank you very much, Tarek. Thank you very much.
For more questions later. Gabriela, please go ahead.
Thank you. Gabriela, Mexican journalist. Thank you for saying that about the Mexican flu. So how do you explain that the virus outside China does not have the severity that it has inside the country? There are fewer cases, fewer transmission person to person, 2 deaths with travel history. So does that mean that the virus is less virulent outside the country, or that the countries affected are taking good measures to contain? And then another question, there is a possibility that some countries are not declaring cases because they fear risks to their economy, travel restrictions, etc. So this is an obvious question, but how serious it is right now to hide information? Thank you.
Yeah. So on the severity, what we know currently about this virus is that people with underlying conditions are more likely to have a severe disease. And so underlying condition means, for instance, people with cancer, already immune deficiencies, or chronic disease such as diabetes that affect your immune system. And also people, all people, I mean elderly, because of course when you are getting older, usually your immune system is a bit weaker. And we see this with influenza as well, that elderly people are more likely to do severe influenza disease. So this may be one of the explanations that so far we don't have many deaths outside China, because probably people who are traveling and coming back from China are not necessarily people that are really old or with chronic disease, but more younger people and people in good health. And so that's why they have the disease, but a much weaker form of it, the disease. But we still have had one case, one death in Philippines 2 days ago, and again it was somebody of 80 years old. So I think it's the pattern we have seen so far. So nothing different really.
But you don't have any scientific explanation or something that the virus is less virulent outside China? I mean, there's no, I don't know how to say. Yeah. I'm not a doctor, but yeah. No, and then on the hiding information, please.
Yeah. No, I think maybe I know that there have been also some information saying that the virus, while spreading, is changing and mutating and so on. But so far we have no evidence of that. It's still quite a stable virus, and I think the difference in severe cases is more due to the fact that currently we have only 158 cases outside China, while we are more than 20,000 cases in China. So just the proportion makes you more likely to see severe cases in China than anywhere else. So I don't think it's less virulent when it goes out of China. It's just we are still very early in the outbreak. In terms of hiding information, well, I think it's very hard nowadays to hide any information, and it's the issue is much more to make sure that the information that is disseminated can be understood properly, and that the communication about the facts is clear on what we know and what we don't know, and what is being done. What we have seen in the past is that people tend to have 3 types of concern. The first concern is on what is the cause of the disease, where did it originate from, and what is it? The second concern is on the disease itself. What is this disease? What does it? What is the transmissibility? What is the severity? And the third type of concern is on what is being done to control it. So, if the communication addresses those 3 issues with what we know or what we don't know in a transparent way, I think usually it's better communication. But hiding information just because you don't know, it's not very good.
I was referring on countries. If a country, if a government doesn't declare that they have confirmed cases, how dangerous could it be? I mean, this is a question.
Declare cases, you mean to WHO? But government, the member states have signed the IHR. They have adhered to the treaty, so they have the obligation to notify to WHO in 24 hours, and so and usually this is what is happening. So I don't think there is any. I don't think they will hide information, and at least when we discuss with our member state, we really encourage them not to delay the notification.
Thank you very much. Let's take last 2 questions, Nina and Isabel, and then we will close this press conference.
Nina Larson, AFP. I wanted to follow up on Gabriella's question also on the deaths. I was wondering, within China, so you haven't seen any indication of a change in the profile of the people who are dying from this disease. If you could say something about do you have an age for the youngest person who's died from the disease, and if you have any idea of the case fatality rate, or do you know when to expect to have a case fatality rate? Thank you.
Yes, so what we, so currently the reported deaths are 425 deaths. We are asking, of course, to have more details on each of these deaths to be able to make some statistics and to understand better what are the key underlying conditions that put people at high risk. And especially we are looking at pregnant women, for instance, or young kids, and to see if the pattern of severity is similar to what we see with influenza, for instance. So these are currently the kind of information we are trying to gather. We do have a clinical network, and we have global teleconferences regularly, at least twice a week, where we are convening clinicians from all over the world, and especially we have some Chinese clinicians joining the call, and we ask them to explain to us what are those severe cases and what are they doing with them, and if they can give us more information. So we are still at the data collection stage and analyzing each case very in depth to make sure that we can, because ultimately the point is to reduce mortality, meaning that what we want is to improve the treatment. So that's why we are collecting all those information. In terms of case fatality ratio, it's very hard during the very first week of an outbreak to have a reliable case fatality ratio, because there are some unknowns about the denominators, and there are also some unknowns about the numerators. So, and it takes some time to clarify those two component. We did some study after the pandemic influenza in 2009, and we thought that it takes at least 4 weeks to have better figures. So I think in the coming days we will be able to give a better estimate of the severity of this disease.
Because do you have an age, a youngest age of any of the people who have died, of the information you've received so far on the deaths?
Not with the latest numbers. No.
Thank you very much. Okay, we'll take Isabel and Bodhi, who will be our last person to ask. Isabel and then Bodhi. Isabel, please.
Yes, good afternoon. Isabel Sacco for FS Spanish News Agency. I would like to know about what you said in your introduction about the meeting you had with the business sector. I would like about what you mentioned on other sectors that I want to meet you. If you had already the meeting with the travel and tourism sector, and in that sense, what do you think about despite all the reassurances that you give to the economy sectors about the stopping of flights by so many companies to China. And in that same area, about the stigmatization of Chinese tourists that we are seeing in many, many countries.
Okay, so the interaction we have with the business sector is through teleconferences, and so it's not face-to-face meeting because they are located in many places in the world. And so we'll have this week as well a teleconference with travel and tourism industry to hear their concern and also to try to provide answer to their concern when we have the evidence. So I know because I was very involved also in Ebola that crew from those companies are really scared of being infected because when they are in a flight, they have very close contact with the passengers, and so they feel really at risk. So that's why we need to define with those companies a specific recommendation so that their staff feel secure, feel protected as well, so that they can resume flying to China. And I think it's more, I mean, at least in Ebola, really the company stopped flying not because they wanted to punish the affected country, but more because their crew was really afraid of getting infected. And I think these are legitimate concerns. People, when they don't know, they can easily be scared and they fear for themselves and their families. So I think it's fair, and we should provide them with the best guidance we can to protect them. On the stigmatization, I think and this is why we are trying also to really work with different audience. It's very hard to combat stigma. As you know, I mean, fear and stigma go together. And when people fear, they tend to also stigmatize some groups. And so what we try to do really is to reduce fear, at least unnecessary fear. I'm not saying that people should be complacent and just forgot about the basic safety recommendation. I mean, everybody should try to stick very cautiously to respiratory etiquette, washing hands, and basic precaution. But at the same time, we need to combat what is unnecessary panic. And for me, I think human community is characterized by three things: intelligence, so we are intelligent animal, I would say, emotions, and social link. And the social link is very important for human community, and unfortunately, epidemics are affecting this social link, because the first thing we do usually to combat transmission is to recommend social distancing. And so that's why fear and stigma often come together. We try to reduce fear so that we can also reduce stigma.
So do you think that after the meeting you will have in the next few days with the travel industry and the guidance the WHO will give, the industry will be ready to resume the flights to China?
So the guidance we have provided will change only if we have new information. But what the guidance we have provided, we will discuss it with the travel and tourism industry to see how they can adapt this guidance to their personnel and employees, so that their personnel and employees are protected, and at the same time they can also implement measures that are commensurate to the risk they have. So I cannot guarantee that they will resume the flight, but what we will discuss with them is making sure that we are communicating well about the risk and the recommendation we have provided.
Thank you very much. We'll go to the last question. Buddy, please.
Yes, thank you, Phoenix TV. Lequel progrès que vous déterminez virus par la séquence génétique? Merci.
Donc, si je comprends bien votre question, vous me demandez qu'est-ce que ça change d'avoir la séquence génétique du virus? Le progrès? Ok. Donc, les chercheurs qui ont pu extraire la séquence génétique du virus ont été extrêmement collaboratifs, puisqu'ils ont tout de suite mis cette séquence en libre accès sur une base de données qui s'appelle GISED. Et cette base de données peut être accessible par tous les chercheurs au monde. Alors ça a un intérêt énorme, parce que ça nous permet premièrement de voir si le virus est en train de changer ou pas, en prenant différents types de prélèvements à différents temps. Et donc, pour l'instant, on n'a pas vu de changement radical du virus. Il y a des changements très très minimes, mais qui n'ont pas d'implication de santé publique. Ça nous permet aussi de mieux comprendre s'il y a des transmissions interhumaines et comment ces transmissions se font. Et donc, c'est un vrai progrès aussi pour nous, parce que c'est plus rapide, on va dire, que des études épidémiologiques qui souvent sont assez compliquées, surtout quand les gens bougent beaucoup. Et ce qui a été le cas au début de l'épidémie, où il y avait beaucoup de mouvements avant que les choses ne se stabilisent. Donc, pour l'instant, on est très content d'avoir ces techniques et de savoir aussi qu'elles sont largement répandues en Chine parce que ça nous aide énormément pour mieux comprendre l'épidémiologie et la transmissibilité de ce virus.
Thank you very much, and thank you everyone watching us on WHO Twitter account. This was Dr. Sylvie Briand, WHO Director for Global Infectious Hazard Preparedness. We will try to keep organizing these thematic briefings so you get to know about different aspects of this outbreak and WHO and other partners' response. Wish you a very nice day, reminding you that we will have an audio file available from this press briefing that will be shared. Thank you.